There is a stigma about having diabetes, and I feel it every day. When you say you've got diabetes, everyone suddenly becomes an expert. Treatment works when you treat people like intelligent human beings.
Many people want to change. They just don't understand what the barriers are and what they can do about them.
It is my distinct pleasure to welcome you to Houston. We are hoping that Houston's journey with Cities Changing Diabetes can inspire us so that when you return home to your community, you have new ideas for tackling this important problem.
The growth in diabetes makes the future healthcare systems unsustainable. So unless we reverse the trend, we are going to deal with healthcare systems that are simply struggling to survive.
Unless we do something today, we're going to be in a situation that literally can't be sustained by people, by society, or by the healthcare systems.
Regarding the role of Cities Changing Diabetes in really changing diabetes, I think that the program or the partnership has a tremendous power in bringing very diverse stakeholders, people, organizations together.
Our goal here is to bring this right to the forefront and say, look, if we want to have healthy healthcare systems and we want them to exist at all, we need to deal with this right now.
Establish a goal is a very good advice for us.
And we'll have some common goals that we'd like to have across groups.
The goal is important, as well as to have something to evaluate the impact. And you have to see how our work is changing the life of the people.
What unites people is to be able to see and have a clear vision for the future, not necessarily to do the same things.
One of the real challenges that we face is that in order to bend the curve of diabetes, we have to take pretty dramatic steps in terms of the prevalence of obesity.
Cities have a huge role to play, and I think their role is often downplayed because they are at a local level, but I believe they play the most important role.
When we work together, we can pool our resources, we can bring new ideas into interventions that take place at city level, and we can share, exchange, and engage practically with each other.
Cities Changing Diabetes will be the mechanism, will be the vehicle. It's city focused, it's mayor focused. Mayors are people who get things done.
As we work together, learn from each other, we will beat diabetes. The trajectory will definitely change.
Cities Changing Diabetes is a wake-up call for all of us to address the global challenge of diabetes.
And if we work together globally, I believe we can make a difference.